Welcome back. Let's dissect the efforts of states to opening up the economy, beginning in Lagos. Dr. Olanlesi Osadiaye, a public health physician, joins me in the studio. Thank you for joining us.
Thank you very much.
All right. How critical is the responsibility for states, seeing as we've had the additional guidelines from the federal government?
Well, definitely it's very critical for the states because obviously the government cannot do everything. They're trying to decentralize, and the states also have a responsibility to actually do some of the things that are necessary to make sure that there's safety for all the members and every other party in the state. So it's very critical for the states to actually also be able to put in all the guidelines that the government has.
So Lagos is the epicenter.
Yes,
it's recording maybe a little over 4,000 in terms of active cases.
Yeah.
And today the governor says religious gatherings can open 40% capacity, minimum 500. Does that trouble you?
Well, definitely as of today, that is troubling. Are we ready for Lagos to open religious? You know, there's been a clamor for it. I mean, everybody wants to. We are very religious people in Nigeria generally, so there's been a clamor for it. So if we're asking, are we ready? As of today, I would say no. But then what can happen within 2 weeks? A lot can happen. People can put in all the necessary guidelines to be able to make sure that we are ready to open as religious.
We're also saying, no food or communion sharing, a common dish or sharing of kettles for abolition. They should all be avoided. So it's also going to be a different way to worship in the pandemic.
Definitely. Obviously, there's so many other safety measures that have to be put in place. From stepping into the church premises, churches have to make available places where people can actually wash their hands. You have to be able to wash your hands immediately you step into the premises. They have to have temperature scanners to check your temperature before you step into the church. Everybody must make sure that the safe mask is compulsory. You know, nowadays we use chin mask. I call it the chin mask instead of the face mask. It's commonly what we see. That's not even acceptable. Everybody must use a face mask. Churches are where you sing and you say, shout hallelujah, stuff like that. That's not acceptable without a face mask. So things have to be put in place before you can go in.
A bit more of the guidelines is below 15, excuse, and then below 65, not allowed. But then you would have people who live with these, young people or children and, the elderly going to church and perhaps coming back with that and putting them at risk.
That you've actually said it all. They're at risk. Once you're going to church and you can expose the elderly who also may have other comorbidities to this disease, then they definitely are at risk to have the disease. Unless you, obviously, people are more aware in terms of the fact that you get home, you have to take your bath, you have to do all those things. But a lot of people still don't even believe COVID exists. So how will they take responsibility for things like that?
I've just been told that Dr. David Ajibade, a general practitioner, executive director of the Brain and Body Foundation, joins us from our Abuja studios. Glad you could join us at this time. One thing that has resonated among most of the speakers at the Presidential Task Force briefing is protecting healthcare workers, and there was a lot of emphasis on training on IPC, infection and prevention control. How much awareness do you think our health workers, the frontline workers, have, especially as they battle the pandemic?
Well, I think they have a lot of awareness. I mean, it's all over the place, and of course, in Abuja hasn't been as bad as Lagos, but there have been several health care professionals who have been infected and have been tested positive. So yes, there's a lot of awareness, and it's not just about protecting themselves or protecting patients. It's also about going back into their community and their families. I know many who actually change and shower when they get back home. They don't even go into the house, maybe go to the boys' quarters or have a shower outside and leave all their clothes outside before coming in, because so as not to get infected or not to infect their families. So, and as the other doctor in the studio has said too, it's really, really important that the doctors too wear their face masks and patients too wear their face masks, because you just don't know. 40% of people simply, they are infectious even before they have a single symptom. So it's very important that doctors be aware of this, and I think they're getting aware of it.
How much do you think, Dr. Ajibade, perhaps patient visits to hospitals are warning this period? There's also been the talk of the dangers of people self-medicating, and this is also on the fears of contracting the virus.
That's a big problem because people go online and they watch TV and they just come up with all kinds of things. Chloroquine is a big example. People just take a lot, even before they get infected, or they think or they suspect they're infected, and it should be clearly stated that if chloroquine or hydroxychloroquine, which is now being used in many centers around the world, is only for the treatment and not for the prevention of the disease. The other problem, of course, is with antibiotics. I mean, we Nigerians are very, very famous for abusing antibiotics. So, and that can cause major problems. If you keep on taking antibiotics, it can cause other issues, but also the whole issue of antibiotic resistance. Hopefully COVID-19 will be over, and we're going to have to still grapple with the problem of antibiotic resistance, which a lot of public health physicians are crying about. So it's very important that people understand that they should not abuse medications simply because they think it's going to prevent COVID-19. I simply like to opt for the more natural ways. We all know things that can help to improve immunity. Just going out in the sunlight, for instance, can help. Exercising in the sunlight can help with immunity, and there are other specific nutrients and vitamins that can help as well.
All right, let me come back to you, Dr. Sajaye, and that is, with regards to checking compliance levels, seeing as, economies are opening up in states, what do you think the level of monitoring should be for the state government across?
Well, I think that there needs to be a task force in place. We just need to go to the market or anything to see that the level of compliance is very low with regards to all the precautionary measures that people should be taking. So definitely there needs to be a task force in place for the churches, for other areas, to make sure that people are actually complying to the regulations that are put in place. And they need to take responsibility for that.
All right, and to you, Dr. Ajibade, tell us about maybe some of the science-backed things that people can do, they can apply at home to prevent them from getting COVID-19.
So I'm always a great advocate for strengthening the immune system. And we know, there are now a lot of studies showing that the patients who have had the most severe cases, those who have died, have been those who have the lowest levels of something as simple as vitamin D. You'd be surprised. There's a study in Italy. They found that Italy, amongst all the European countries, has among the lowest levels of vitamin D. And you can see from the news that they are among the worst hit in Europe. So vitamin D is people tend to overlook it because because we think we're out in the sun, but we're not really out in the sun that much, and we're clothed a lot. So I would strongly recommend vitamin D, and it needs to be taken consistently over months to get to the level that will help to protect. Vitamin A is very important for the lungs. It's important for the maturation and development and protection of the lungs. Very, very important as well. Vitamin C. Zinc is actually being used in isolation centers and in treatment all over the world, along with hydroxychloroquine, for the treatment of COVID-19. Of course, it's in higher doses, but you can take the minimum required doses by physicians that can help it. In fact, they found out that 16% of all pneumonias and lung conditions are because of a decrease or deficiency in zinc. So I would recommend those 4 nutrients for people to take on, and they're safe enough to take too.
Anything?
No, I think he's covered most of the bases. Definitely, those are the things that are necessary to build your natural immunity.
All right, we'd like to thank you, Dr. Lanlesi Osajaye, a public health physician. Thank you for joining us. And also, Dr. David Ajibade, thank you for joining us on the program.